Hello. It's been a while. I have not made a video in like a while, a couple months. I've been in nursing school and I'm about to finish my first semester, which is like why I'm making a video because we're finally done with like having 4 tests per week, and now we're about to transition into like finals. But I have like a few days before I have to like buckle down and like actually lock in and study for finals like every second of every day. So just thought I would make one while I have some time. Yep. I don't know what to talk about. My name has been going crazy. I've never been humbled so bad until I went to nursing school. And I don't know, it's bad. I'm getting surrounded by mosquitoes right now. We might have to move. Just letting you know ahead of time. I'm not rocking with it. Yeah, I don't know. I've been getting whooped. I'm passing though. It's so relieving, or kind of, like it's supposed to be relieving when you could take the final and like fail it and still pass the class. But I still want to do really well, so it's like there's no relief. Hold on, we're moving. Okay. I'm gonna go over this way. Oh, spider webs. Awesome. Over here. Okay. Am I dripped out? I don't know. I might just have to crouch down. It'll be fine. Yeah, no, uncomfortable. Set you up here. Okay, perfect. Kind of. But yeah, I've been getting whooped. It's crazy. You know what? I really started liking old people. I feel like a lot more. Because when you're younger, I feel like, at least for me, I was very, I hate authority, or I pretended to be, even though like I still followed like all the rules. I don't know, but I didn't like it, and I feel like a lot of older people are kind of grouped in that, and I feel like I was like, dare I say, ageist, because I was like, oh, older people just like hate all gay people and all like racist and suck. But I've been doing clinicals, and obviously that's an exaggeration. I did not actually like totally think that, but I've met some like that, and that's why I was kind of wary, you know. Have some family members, distant family members. But anyways, working in the nursing home, or not working, but like doing clinicals there, it's been really awesome, and I love geriatrics. They're freaking awesome, and I wish that I had the opportunity to do that when I was like 14, like a hater, because I would have, well, actually, I don't know, I still might have been a hater, because I just kind of hated everything then, but I love it now. What sucks is like a lot of people tell me not to work in geriatrics, because that's like nursing homes typically, not always, but typically, and apparently there's like a lot of liability there, just like so lame. Obviously we want to avoid liability. At first I thought I wanted to be a psych nurse. I don't know, to be decided. But you know what's crazy though? I really think wound care is super interesting. And I know that's like, a lot of people think it's gross, but I don't know, I think it's really interesting. I mean, it really sucks for people because a lot of times they're in pain. Though sometimes, depending how deep the wound is, some of the nerve endings will like be gone, so they won't really feel it. But they'll give them a bunch of morphine anyways to like help control their pain. But I thought it was really, really interesting. So I'm considering going into wound care, geriatrics. But I've only been at done clinicals at the nursing home so far because it's just my first semester. Yeah. Peace and love, guys. I say that, I'm like, I don't know, I've been such a hater, I think because I've been stressed out, and I hate working, like, dude, I feel like I'm so crazy because I would rather go to unpaid clinicals and like dare I say, wipe people's butts than like go serve tables. What is wrong with me? I don't know. I don't know what's wrong with me, but I don't know, man. I just love people. But they tell me not to work as a CNA because you get like overloaded really fast and it's like crazy. My necklace is all jacked up. And it's like really bad. So we're just gonna have to wait till I graduate, I guess, maybe. Which is crazy to me, I guess, because you'll meet some of the sweetest freaking people. Like a lot of people, and I'm not saying everybody, obviously, and even if they weren't nice, there's no problem with that, like obviously, but a lot of older people at the nursing home are so like kind to you and so understanding. And at least the ones I worked with, I know that there's not a lot, like that's not the case for everybody, but the ones I work with, so kind, so understanding, and like just so grateful. They're like, oh, I'm so happy that you're here for me, I'm very grateful for y'all, and they love and appreciate everything you do. And it's like you're seeing people at their most vulnerable, and like they're still so kind, and a lot of them still have like so much love to like give other people, but then other people like won't give them the time of day, you know, sometimes. And it's really upsetting to me, but I mean, I can't change the entire system, I've been told, so I'm just gonna have to learn to get over it. It's just really sad because I've seen residents who have like so much love in their heart. They just want to give you hugs and they just want to talk to you, and they'll just be like ignored, or like I don't know. It just makes me really sad because they got so much love and it's got nowhere to go. So I'm being bit up by mosquitoes right now, by the way. That's why I'm like moving, so I'm getting harassed. Crazy. We're moving again. But yeah, I was making a point earlier, I forgot what I was saying. But anyways, I've only worked in nursing home so far. I think we're gonna do clinicals at the hospital next semester because it's like med surg. And then we're doing clinicals, I know we're doing clinicals at the state school eventually. I just don't know like exactly when, you know? But yeah, I was scared when I first went into nursing because my parents had always advised me to do it. That I was just doing it because like my parents wanted me to. So I'm really glad that like, I don't know, I actually like it and it's like awesome. I really don't think I would rather be anywhere else. It just makes me really sad though, because I've met some nurses who have like no passion for nursing. They're just there like because they have to be, or for money, or I don't know. But they like hate their jobs and hate their patients, and it's like, oh my fucking god, literally choose any other fucking career. But it's okay. It's not okay at all. But there's nothing we could do about it. Unless the entire system was reworked, but that won't happen overnight, so. Anyways, yeah, I've been getting whooped by my classes. I say that, I have like A's in most of my classes. I have 2 B's in pharmacology, and I think in basics of nursing, but that's because I did really bad in one test, and that just kind of screwed me over. But I think I'll get it back up to a 90. I really do. I think by the end, I think the final, I'll do good on the final, so I'll bring it back up, and I'll only have 1 B in pharmacology. But man, I'm just glad I'm passing. I'm just glad I'm passing, because I started it in the freaking summer, and I had no idea that it was shorter than all the other semesters, because a normal semester is 16 weeks, and a summer semester is 12 weeks. And it's the same amount of content, so they just jam it all into the rest of it. So we have like a month extra of content jammed into all the weeks. So instead of like kind of having some pacing, it's like we have a test in every class almost every week, and then we learn new material and we test over that, and then we learn more and we test over that, and it's, we have clinicals, we have clinical paperwork, and it's like 20 pages long, and we have 3 days to do it, and we do it every week, and I'm going crazy. But I have my last one this week. I'm actually, I need to go work on that. I'm kind of procrastinating, that's why I'm making this video. But yeah, I don't know, I love nursing. I'm sorry, I haven't been talking a lot, but or making videos, you know, but I've been busy with school. I've been locked in. Yeah. Anyways, just a little video so that y'all aren't totally neglected for the rest of forever, and to make sure that y'all know that I'm like still alive. So, okay, bye.